Hello friends, today I'm here with some of the sample questions for CBT examination. Hope you guys will benefit from this. Question number 1 is which is not a cause of postural hypotension? There are four options. Option A, the time of the day. Option B, lack of exercise. Option C, temperature. Option D, recent food intake. So the correct answer is option C, temperature. Question number 2 is which is not an expected side effect of lumbar tap? The options are option A, headache, option B, back pain, option C, swelling and bruising, option D, nausea and vomiting. The correct answer is option D, nausea and vomiting. Question number 3 is a client was diagnosed to have infection. What is not a sign or symptom of infection? Option A, a temperature of more than 38 degrees Celsius. Option B, warm skin. Option C, chills and sweats. Option D, aching muscles. So the answer is option C, chills and sweats. Question number 4 is what is respiration? Option A, the movement of air into and out of the lungs to continually refresh the gases there, commonly called breathing. Option B, movement of oxygen from the lungs into the blood and carbon dioxide from the lungs into the blood, commonly called gaseous exchange. Option C, movement of oxygen from blood to the cells and of carbon dioxide from the cells to the blood. Option D, the transport of oxygen from the outside air to the cells within the tissue and the transport of carbon dioxide in the opposite direction. The correct answer is option D, the transport of oxygen from the outside air to the cells within the tissue and the transport of carbon dioxide in the opposite direction. Question number 5. You notice that a colleague committed a medication administration error. Which should be done in this situation? Option A. You should provide a written statement and also complete a trust incident form. Option B. You should inform the doctor. Option C. You should report this immediately to the nurse in charge. Option D. You should inform the patient. The correct answer is option C. You should report this immediately to the nurse in charge. Question number 6. A patient on your ward complains that her heart is rising and you find that the pulse is too fast to manually palpate. What would your reaction be? Option number A. Shout for help and run to collect the crushed trolley. Option B. Patient to calm down and check her most recent set of blood and fluid balance. Option C, a full set of observations: blood pressure, respiratory rate, oxygen saturation and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. Option D, check baseline observations and refer to the cardiology team. The correct answer is option C, a full set of observations: blood pressure, respiratory rate, oxygen saturation and temperature. It is essential to perform a 12-lead ECG. The patient should be then reviewed by the doctor. Question number 7 is you are looking after a post-operative patient and when carrying out their observations, you discover that they are tachycardic and anxious with an increased respiratory rate. What could be happening? What would you do? Option A, the patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. Option B, the patient is demonstrating symptoms of atelectasis. Administer a nebulizer, refer to physiotherapist for assessment. Option C, the patient is demonstrating symptoms of uncontrolled pain. Administer prescribed analgesia. Seek assistance from medical team. Option D, the patient is demonstrating symptoms of hyperventilation. Offer reassurance, administer oxygen. The correct answer is option A. The patient is showing symptoms of hypovolemic shock. Investigate source of fluid loss, administer fluid replacement and get medical support. Question number 8 is why are elderly prone to postural hypotension? So the options are option A, the baroreflex mechanism which control heart rate and vascular resistance decline with age. Option B, because of medications and conditions that cause hypovolemia. Option C, because of the less exercise or activities. Option D, because of a number of underlying problems with BP control. So the correct answer is option A, the baroreflex mechanism which control heart rate and vascular resistance decline with age. This is the one which does not apply. Question number 9 is, when do you see problems or potential problems? So the options are option A, assessment, option B, planning, option C, implementation, and option D, evaluation. The correct answer is option A, assessment. The 10th question is, a COPD patient is about to be discharged from the hospital. What is the best health teaching to provide this patient? Option A, increased fluid intake. Option B, do not use home oxygen. Option C, quit smoking. Option D, nebulize as needed. So the correct option is option C, quit smoking. Don't forget to subscribe to my channel for more similar videos. If you like this video, please comment in the comment section below so that I can prepare similar videos in the future as well. Bye bye and see you soon.